Well, a part of my interest, special interest in bronchial asthma and interstitial lung disease, pulmonary fibrosis, sarcoidosis, hypersensitivity pneumonitis. In reality, I am a general pulmonologist also, no? In fact, during my life, I have seen about 130,000 different patients. So it's my interest also to diagnose the patients with a lung disease. And the difficulty of the diagnosis in lung disease is that the clinical manifestations are very, very few. You have cough, you have dyspnea or breathlessness, you have pain, sometimes fever, expectorations, and with 7 or 8 or 10 different symptoms, you must make you must diagnose a lot of entities, because all the entities make the same manifestations. So this is important to the interest of the pulmonologist in diagnose precisely the disease that the patient has in this moment. No? For this, well, the doctor must have experience. I've seen a lot of patients. They have to study pulmonology, to know the different entities, etc., to go to Congress, to give lectures to the students, and if they do research, much better, because to do research you have to study a lot, to see what they have published recently, etc. And also all this compendium make that you are a doctor that are able to diagnose the different entities, no? And this is what is my practice. And something that I want to point out is that the importance of the clinical history. So if we say to our students that if you don't do a good clinical history, you never arrive to diagnose precisely a patient. So the first of all is a very good anamnesis, we call clinical history, and you let the patient say his symptoms and all manifestations, and after you ask the questions to arrive to have a suspicion of the disease. And afterward, if you have a very well done clinical history, after with very few ancillary tests or complementary tests, you can arrive to a precise diagnosis. And if you arrive to a precise diagnosis, so you look for the best treatment. So very important in my practice is to make a very accurate clinical history, because the same patient tell you what he has very much times, no? So afterward you make an X-ray, CT scan, etc., and you arrive to a correct diagnosis. That is the most important, to give the treatment the precise treatment.